The Healthcare Labyrinth Podcast is back for another episode. Join Marc S. Ryan, a veteran health plan and health technology executive, as he explores the world of healthcare.
Welcome, everyone, to this edition of the Healthcare Labyrinth Podcast. My name is Marc Ryan, and it's a pleasure to be hosting the podcast, and thanks to everyone for listening in. We're going to continue a little bit with our election year theme. On last week's podcast, we talked about the possibility of an October surprise for Democrats when MA benefit reductions and potentially standalone Part D benefit reductions and premium increases occur in those products. CMS is trying to work their way around the issue of a huge surge in premiums in those standalone Part D known as PDP products, but we still think that there will be premium increases nonetheless. So about 57 million Americans will have to look again at their plans, either in MA or in the standalone PDPs. And that could certainly constitute an October surprise for Democrats if they see major benefit reductions and premium and other cost increases. But this week, what we're going to talk a little bit about is many are asking the question whether insurers would do better under a Kamala Harris or a Donald Trump administration. And more specifically, people are also asking, tell me, would the Medicare Advantage program, the big moneymaker usually, we know there are some problems going on right now, but would the big moneymaker Medicare Advantage do better under a Kamala Harris or a Donald Trump administration? So we're going to try and answer both of those questions here today. Let me just start out by saying the answer is by no means clear-cut or easy. There are clearly pros and cons of having either a Kamala Harris or a second Donald Trump administration. And frankly, some of my answer could be determined by the makeup of Congress as well. Does a given leader, either Kamala Harris or Donald Trump, have complete control of Congress as well, and can their agendas be fully implemented as an example? So again, not an easy question to answer, and there's a lot of factors in here. But let's go to my quick take on the issue. We're going to take a couple of breaks here, and I'm sure we'll be covering more of this as Election 24 rolls on. But we're going to sort of do this in a pro and con standpoint right now. And again, I want to let you know, I'm sort of doing it from the standpoint of a health plan thinking about it. Don't take this as my endorsement of either one of the candidates. I'm just trying to be rather dispassionate and think about where health plans stand in the market, and more specifically, where they may stand on MA, to try and decide what president might be better for insurance, and more specifically, MA. So before we take our first break, we are going to cover what I'm going to call the Trump pros. And what are the Trump pros related to insurance and Medicare Advantage here? So why would insurers like Donald Trump as president? And here are those pros. So number one, under a Trump administration, I believe private health plans would be relatively safe from efforts to destroy them using things like Medicare for All, and other grandiose schemes. So as we know, President Trump and generally Republicans are really pro-private health plan. They do not want to see either a single payer system in the United States or socialized medicine in the United States. So in a general sense, health plans would be safe because they do have a fondness for the private sector in general, and in this case, private health plans. Number two, while there could be antitrust focus from either administration, I do believe a Trump administration would scrutinize health plans less than a Harris one. So you might have the FTC, the HHS, DOJ looking at consolidation, either vertical or horizontal consolidation in the industry, and they may attempt to attack or stop certain consolidations. But in a general sense, I think a Trump administration would really scrutinize health plans less than a Harris one. They could be looking at provider consolidations, which is a big worry, but they probably would be more friendly to health plan consolidation. Next, I would also say that Trump is known to favor an expansion of MA as a way to reduce costs and promote choice in the overall Medicare program. In a general sense, he thinks that MA is the way to go. People will get better care at less cost to the Medicare system within MA. It doesn't mean he's necessarily going to close down the fee-for-service system. He didn't do so, but he did talk a great deal about how MA is very beneficial to seniors and those with disabilities that are enrolling in the program. I would also note that certain prominent conservative think tanks, including the Heritage Foundation through Project 2025, as well as the Paragon Health Institute, as just two examples, have sort of said MA is the way to go as well. So to the degree that he looks at those kind of institutions for some sort of guidance, I think MA is clearly something that those organizations support as well. And lastly, on the pro side for Trump here, I'm going to sort of say in general, health plans and pharmacy benefit managers may face less overall scrutiny or efforts for reform. A little different than the antitrust matter, so that's why I broke this out. So what I'm saying here is Trump will probably not, in a great sense, want to attack the reform of health plans and the reform of PBMs as a matter of overall policy in his administration. Now, I want to make one point here, though. That does not mean there wouldn't be changes to either health plans or PBMs. I think you will have a regulatory reform agenda for health plans. I think there's the likelihood that Trump will create some policies related to drug pricing that would clearly impact PBMs. But what I'm just trying to say here is when we compare Trump to a Harris administration, the focus will not be on reforming health plans and pharmacy benefits managers exclusively. It will not be a sole or a supreme policy of the Trump administration like it might be for the Harris administration. So with that, we've talked about our pros here. Let's get a little bit into our Trump cons. And so here, first I'd want to talk about historically the fact that Trump and his GOP compatriots have been anti-coverage expansion. So while they support private delivery of health care and private health plans, they have not made coverage expansion a big agenda item. In fact, you can see in various lines of business like the exchanges and in Medicaid, they've actually been anti-coverage expansion. So what does that mean? Well, growth of enrollment and the chance of greater margin in revenue probably would be less under a Trump administration than under a Harris administration. So private plans are safe, but they are not going to expand as much because Trump has generally been anti-coverage expansion, and we're going to get into that right now. Next, Trump and Republicans could relook at repealing and replacing Obamacare in favor of Medicaid and uninsured coverage block grants to states. We know that under Trump 45 in his first administration early on, the Republicans made a play at getting rid of the Affordable Care Act and essentially replacing it with this devolution of Medicaid and uninsured block grants to the states and allow states to create coverage initiatives rather than the federal government. We know that that failed. It passed the House, but it did not pass the Senate. Our friend, the late John McCain, came back during his diagnosis with brain cancer to actually be one of the deciding votes against passing the repeal and replacement of Obamacare. It would have led to a huge millions of Americans losing coverage. So here there's a possibility, I don't say a probability, but a possibility that Trump and the House Republicans could come back and repeal portions of the Affordable Care Act and Obamacare and replace it with something else, just like they tried to do in the Trump 45, 2017, I think was the year. I will say, though, that if you look at Vice President candidate J.D. Vance's views on coverage, he grew up in a impoverished household, and he has spoken out and said that coverage is actually a good thing for the poor because it gives them stability and it allows them to get into the workforce and things like that. So we've said the idea of repealing the ACA and Obamacare is not necessarily a very good idea, and it's probably a good use of money for the working class. So Vance's views could moderate Trump's views on this repeal effort, which he has again raised, not as much as he did back in 2017, but he's raised it again. And Vance's views on coverage could perhaps push Trump not to do it and at least talk sense a little bit into the Republicans about what they want to do on the Affordable Care Act and Obamacare. The next con here is even if the Affordable Care Act is not attacked again, I think you need to look for Trump in any GOP-controlled House and maybe even a complete Congress to look to Medicaid for big savings, perhaps a block grants just for Medicaid or related changes. And that's really because of the commitment that Trump has made on extending tax cuts, as well as the promise not to touch Medicare. We know that health coverage programs, Medicare, Medicaid, are sort of the biggest granddaddies of spending. And if he has taken Medicare off the table, Donald Trump that is, and he wants to extend the Trump tax cuts, which cost hundreds of billions of dollars a year, he's going to have to find savings elsewhere or the deficit blossoms. And so more than likely, the Republicans and Trump would look to Medicaid for big savings. Now, I'm not arguing that there should not be some reform to Medicaid, but I think what the Trump and Republicans would do on Medicaid would be very, very far-reaching. I think block grants are a bad idea. There are other ways, perhaps, to control costs in Medicaid, but it is very possible, given the fiscal climate, commitments to protect Medicare, and commitments to extend the tax cuts, that Medicaid could be on the so-called chopping block. Trump, too, would clearly rein in investments in the exchange and favor restrictions on Medicaid expansion generally. So what I mean is if he doesn't go after the ACA and repeal and replace it, and even if he doesn't do major block granting or other kind of major changes to Medicaid, in general, you're going to have Trump pulling back on these programs. Regulatorily, he might do what he did last time and constrain marketing and outreach in the exchanges and potentially rework open enrollments again and be much less friendly to enrollment in the exchanges. And in the case of Medicaid, he's definitely not going to back at his new CMS expansive waivers to expand coverage in Medicaid. And more than likely, he would go back to allowing states to impose work requirements for expansion populations at the very least. So again, expansion in a general sense in the exchange and Medicaid would be curtailed under a Trump 47. And lastly, it's almost a certainty that the enhanced exchange premium subsidies that now go through 2025 that were fought for by the Biden administration would die as of 1/1/26. There's no question in my mind about that. I don't think he would back those. That has led to millions of more people enrolling in the exchanges because those subsidies were enhanced and they created better affordability really across the board for people to enroll in the exchanges. But I do think that they would die as of 1/1/26 if Trump has a Trump 47 administration. With that, what we'll do here is we'll take our first break and we'll come back to talk about the Harris pros and cons.
Health plans and insurance are confusing. Our healthcare system is in dire need of reform. Health policy expert Marc Ryan tackles both issues in his book, The Healthcare Labyrinth. It is both a guide to navigating health plans and fixing American health insurance. Marc dives deep into how health plans and the American health insurance system operate. He then outlines a comprehensive reform agenda for the system as a whole, including pricing, emphasizing health and care management, and ensuring affordable access to health coverage in a private delivery model. Marc is a bit of an unconventional Republican in that he believes affordable access is the morally right thing to do, and that it is also fiscally prudent for our nation. Learn more about Marc's book, The Healthcare Labyrinth, at healthcarelabyrinth.com or search at leading bookseller websites. Available in print, ebook, and audiobook forms.
Welcome back, and we hope you're enjoying this discussion on whether insurers would do better off under a Trump or a Harris administration. We covered the Trump pros and cons for insurers and did a little bit about Medicare Advantage as well in there. And now we're going to talk about the Harris pros and cons here. Well, let's talk about Harris pros on the insurance front first. And again, these are sort of the counterpoints, perhaps, to what I talked about with Trump above. So in essence, the Trump pros become the Harris cons, and the Trump cons become the Harris pros to some degree. So here are the Harris pros here. Well, Harris and Democrats are largely pro-coverage expansion and healthcare investment. So while, again, Donald Trump may like private plans a lot more than perhaps Harris and the Democrats, it is also true that Harris and Democrats like coverage expansion and healthcare investment. So that would mean that plans would probably have a better chance in that sense at more revenue, more enrollment growth, and more margin. Next, Harris would continue efforts to expand Medicaid and the exchanges. And as we know, both of those are largely private managed care. So at least in the short term, those Harris and Democratic efforts to continue to expand Medicaid and exchange would accrue to the benefit of health plans. Medicaid would continue to see waivers with major coverage expansions and things like that, and greater ease of staying in Medicaid and tougher disenrollment requirements in the exchanges. She would do probably exactly what Biden has done, have very liberal open enrollments, special enrollments, outreach, and marketing funding, and probably push very hard on this third point here to extend the premium subsidies that are set to expire at the end of 2025. Now, whether a Harris administration could do that depends on who is in control of Congress. If the House Republicans remained in control, the enhancements likely would not happen. But if the House Democrats were in control of that chamber, there's a better chance that a deal could be cut to expand, to either make permanent or extend the enhanced subsidies in the Senate. Again, no guarantee, but there's a better chance. So in sum, on the pros, Harris and Democrats are very pro-coverage expansion. Number two, they would continue efforts to expand Medicaid in the exchanges, and they would push very hard, at least, to extend or make permanent the enhanced premium subsidies, whereas Trump would probably signal his desire not to have them at all extended. So let's get to the Harris cons here. So number one, while Harris and the Democrats claim to support Medicare Advantage, they are far less enamored with the private program. That's very clear. While Trump likes it and loves it, endorses it, Democrats seem to say, I'm okay with MA, but they're less enamored with that private program. And that could certainly be an impact to the MA health plans out there. The Democrats and Harris see it as over-reimbursed and would rather make investments in traditional Medicare fee-for-service, which don't have a lot of those additional benefits that MA has. And I think you would see a major effort to rein in overpayments from Harris and the Democrats if they were in power, for sure. Number two, at some points in time, Harris appeared to support Bernie Sanders' pure form of Medicare for all, which would essentially eliminate private health insurance. So that would certainly be seen as a threat by the health insurers. Now, I will say at other points in time, her Medicare for All plan was sort of different, and it maintained private health plans to run parallel in the system, maybe permanently, but at least for a decade or at least for some time. So she moderated her endorsement of the pure Bernie Sanders Medicare for All to a more measured Medicare for All one, where you would have the fee-for-service program and perhaps private plans run together. But she was very clear that requirements for participation of health plans in her modified version of Medicare for All would have some very strict requirements. So that would worry health plans in and of itself as well. And anytime you have sort of a state option and strict requirements matching up private plans to, for example, state option, things are not nearly as lucrative or beneficial to private health plans. I would also tell you that VP nominee on the Democratic side, Tim Walz, appears to the left of Harris on many healthcare issues. So this might not be a very good thing either, but that would worry health plans as well. And lastly, on the con side, Harris would continue efforts on the antitrust front. Again, there's a possibility that there could be a little more activism on the Trump side, but we know that Harris administration would continue the Biden administration's efforts to really focus in on vertical and horizontal integration, both in the payer and the provider world. And that's coming to fruition under the Biden administration through regulations and activism through the DOJ and the FTC. And that would clearly continue under a Harris administration. She was very, very active on this front as the Attorney General of California. She has a clear track record on this front. And so that would continue. And certainly that would worry not only providers, but health plans as well. With that discussion of the Harris pros and cons for insurers, we'll take our next break. And when we come back, we'll talk about where a Trump or a Harris administration might actually see eye to eye.
Lilac Software is proud to work with the Healthcare Labyrinth website to educate people on the healthcare system. At Lilac, we believe transparency is so important in healthcare. The healthcare system is opaque, and Lilac is trying to bring clarity to data and unleash the best member care, reduce costs, and improve outcomes. Our cloud-native payer platform revolutionizes data insights and analytics. Plans have all the data they need, but in silos locked away in point solutions. At Lilac, we solve the data fragmentation problem and help plans turn complex data into actionable insights, leading to greater operating leverage, tight cost controls, and healthier members. Health plans can improve STAR scores, reduce medical expense, drive revenue, and more. Quite simply, with Lilac, you can drive better business and health outcomes. Learn more at lilacsoftware.com.
Welcome back, and we hope you're enjoying this episode of the Healthcare Labyrinth Podcast. We have so far discussed the pros and cons of Trump in terms of what health plans would want to see, and the Harris pros and cons in terms of what health plans would want to see. We layered in some discussion about where they stand on Medicare Advantage as well. Well, now we're going to turn to areas that the Harris and the Trump administration may actually see eye to eye. And I really sort of call out two issues here. So one, despite Trump's support for MA, given Medicare solvency issues, it is likely that either administration would seek to rein in costs in the MA program to some degree. So let me just sort of uncompact that a little bit. I told you earlier that Trump loves MA. He loves private delivery. I also told you that that Harris sort of knows that MA private plans are out there to be, at least for some period of time. So in that sense, MA will continue. But I do believe that both administrations, either administration, would begin to have to rein in some costs in the MA program, given Medicare solvency and given some of the politics of overpayments out there that frankly touches both sides. The Democrats talk a lot more about overpayments, but certainly Republicans are talking about it as well. So what could this include from either administration? Well, either administration and Congress in the next administration could look at rates, risk adjustment, and overpayments and do some reforms there. They could look at this STAR program. They could look at supplemental benefits, and I've done some podcasts on that as well as agent broker compensation. So these are areas that are ripe for some potential look-ats, so to speak, by either administration, and that clearly would impact the revenue and potentially the margins that MA plans could have moving forward. So that's sort of the fact that both administrations could look at MA finances, let's say, in some way. The second area where either administration might see eye to eye is drug price reform. And drug price reform could continue under either administration. As we know, the Biden administration fought and successfully passed the beginning of Medicare drug price negotiations. So that is ongoing now. That is phased in over time. The first 10 drugs will have prices set as of 1/1/26. But over time, as many as 60 Part D retail and Part B medical drugs will have either negotiated prices or upper limits, a price fix on these 60 drugs. President Biden is known to want to expand that program under a Harris administration. If the bodies line up in Congress and there is control of both chambers, as an example, I believe that Harris would try to expand that Medicare drug price negotiation program to all drugs in Part D or Part B, or at least substantially more. What I would note on the Trump side is Trump 45 supported something similar in that he proposed a rule for Part B medical drugs that would force negotiations and then later ensure that these prices in the Part B world would not be over the international reference prices out there. What international reference pricing is benchmarking drug costs or drug prices in your country against those of other countries. So Trump did support negotiations and benchmarking prices against other developed nations. And he also said that he would extend that to the Part D program in the future. So whereas there's more of a straightforward drug negotiation process in Medicare by Biden, Trump did support something similar, at least, for drug prices in the Medicare program as well. Trump also seemed sympathetic to the idea that these prices over time should go throughout the system to commercial lives as well. And we know that the Biden administration has said they would support that, and Harris would as well. So that's just one area, drug price reform, where Trump and Harris might actually see eye to eye. So with that, we're going to take one last break here, and we'll quickly come back just to do a couple minutes of summary.
The Healthcare Labyrinth is no ordinary website. It features news and commentary from one of the nation's leading healthcare policy and technology experts. Marc Ryan combs the internet for the latest healthcare news and publishes a news feed each weekday with summations and Marc's insights. Twice a week, Marc publishes a blog to go deep into a current issue. And of course, Marc hosts a podcast each week to delve even further. All of this is available at healthcarelabyrinth.com. Visit each day for the latest happenings in healthcare. As well, learn more about Marc's book, The Healthcare Labyrinth, at the website. That's healthcarelabyrinth.com, your go-to source for for healthcare news.
Welcome back. And we are talking about whether insurers will do better under a given administration, Harris or Trump. And so we just promised to do just a very quick summary here before we end. So in a general sense, I sort of wrote down 3 things that we need to think about when thinking about whether plans would do better under Trump or Harris. So number 1, with a Trump 47, in general, you would see administration that is pro-private delivery of healthcare. So that's certainly a benefit. But the administration would be anti-coverage expansion. So less opportunities for health plans, so to speak. On the MA front, I think a Trump 47 would be more sympathetic to MA. So that's a benefit there for MA. On the Harris side, a Harris administration, I believe, has questionable commitment to private delivery, just given her equivocation in the past related to Bernie Sanders' Medicare for All, which she initially endorsed in full, and then she pulled back on that, where private delivery was at least part of the equation for some time. But the Harris administration is generally pro-coverage expansion. And on the MA front, I would think that Harris would be less sympathetic to MA. But there's no question in my mind that given the fiscal situation, both administrations would have to do something on MA overpayments and reform. And where they also see eye to eye would be on drug price control. If Trump continues some of his views from his first administration. With that, we will end this edition of the Healthcare Labyrinth podcast, and we'll see you next time. Take care.
Thanks for joining Marc and the Healthcare Labyrinth podcast. Go to healthcarelabyrinth.com each day for the latest healthcare news. See you next week on the next Healthcare Labyrinth podcast.